This is CTV News for Monday, April 30th. I'm Monica McNutt. Thank you for joining us. Detectives are investigating a police-involved shooting in Greenbelt. Authorities say while serving an arrest warrant at an apartment complex on Cherrywood Lane, an officer shot the suspect. Chief Hank Sawinski says the suspect was taken to the hospital in critical condition.
Prince George's County Police Fugitive Apprehension Team were contacted by members of the Metropolitan Police Department who had been attempting to apprehend a Corey Markel Janifer. He's a 26-year-old African-American male who is suspected to have committed a robbery and shooting in the District of Columbia 3 weeks ago. We were invited into the apartment when we knocked and announced ourselves by family members of Mr. Janifer. We were in the process of allowing him to present himself. We made several requests, but he had placed himself behind a closed door. My preliminary information is that after by name asking him to present himself several times, officers were in a position to force that door.
No officers were hurt in the incident. Senator Van Hollen has some ideas on how to make health care more accessible. Denise Douglas is standing by with details.
Thank you, Monica. Listen to this. Black and Latino adults are less likely to rely on a private physician for their medical care than white adults. That statistic is from the Kaiser Family Foundation. A symposium held today at Johns Hopkins University was meant to address that and other issues having to do with health disparities. Senator Chris Van Hollen was among the speakers. He talked about ways to improve access to health care and to reduce disparities.
It's not asymmetrical. It has regular borders. It only has one.
So we talked about some of those fundamental sort of social safety net programs, including on healthcare, and then the attack on those programs now at a time when we need to actually do more to expand them, because we have lots of healthcare disparities in the country. If you look at different communities, the African American community has much higher incidence of healthcare needs, and we need a system, a healthcare system, that makes sure that we have good quality care for everybody, and that has to be designed in a way that addresses the needs of every single person, no matter what the community.
Congressman Elijah Cummings, Kathleen Kennedy Townsend, and the president of Johns Hopkins, Dr. Ronald Daniels, were also part of today's event. Today, Attorney General Brian Frosh is taking aim once again at price gouging. He filed a petition for a rehearing with the Fourth Circuit Court of Appeals. The judges ruled recently that a law passed last year to stop the sharp increases in the price of generic medicines is unconstitutional. Frosh wants that overturned, saying such a move would safeguard access to prescription drugs for Marylanders.
Well, it means that consumers can depend upon reasonable prices for generic drugs. Generic drugs have been one of the great bargains in healthcare for Americans for generations. And as I said, in recent years, the prices have just started to skyrocket to the point where people who depend on them just can't afford them. They have to choose between paying the rent, taking their drugs, eating, helping their kids. It's a life and death choice for some people. We want to make sure, we want drug companies to make a profit, but we want to make sure that citizens get drugs at a cost that's reasonable.
Frosh says it could take several months before the rehearing goes before the court.